Collective Insights is a voyage through topics and technologies revolutionizing human well-being. Groundbreaking approaches for a better world and a better life await you. Welcome to Collective Insights. Collective Insights and the work we do at Neurohacker Collective is made possible from the support of our community and the sales of our product, Qualia. Qualia is a comprehensive mental enhancement supplement designed to improve focus, mood, and flow state. Learn more about Qualia at neurohacker.com and use coupon code CollectiveInsights20 for $20 off your first order.
Welcome to Collective Insights. I am a naturopathic doctor and your host, Dr. Heather Sandison. I'm the medical director of North County Natural Medicine and on the medical advisory board for Neurohacker Collective. I'm excited to welcome both Justin and Scott from Joovv today to explain more about their red light therapy device. I have one in my office and patients are giving rave reviews ranging from decreasing pain to improved mood. So selfishly, I'm so glad you guys are here today because I get to ask you some of the questions that have come up in my office, and I'm sure we'll be able to get the answers. So the research and published literature on red light therapy is extensive. Just to name a few of the benefits, there's lowered inflammation generally in the body, help with osteoarthritis and joint swelling, improvement of hypothyroidism, increased cellular energy, increased performance, improved recovery times, certainly response to training, increases in testosterone and fertility improvements, skin benefits kind of across the board, firmer skin, improved oral health, reversal in hair loss, and then nerve regeneration. So Scott, why don't we start with you? You have a background in traditional med tech and then biomedical kind of background. Can you tell us where you learned about that?
Yeah, so Heather, thanks for having us on. Looking forward to the conversation, especially considering your experience with our product and light therapy over the past several months here. But yeah, my background, I spent really my entire professional career in the traditional med tech space, or the traditional medical device space. So with companies like Boston Scientific, Bard, Covidien, Medtronic, kind of the big device companies that are all generally located or based in Minneapolis. But my wheelhouse up until starting Joovv was really the cardiovascular space. So a lot of the products that I helped commercialize were cardiovascular stents, atherectomy catheters, et cetera. But yeah, that's where I spent really close to 15 years in the traditional med tech space before starting Joovv.
Well, welcome. We're so excited to have you. And Justin, your background is more in the engineering side. So on, really the side of this that I need the most education. I feel like my background aligns much more with Scott's than yours. So you have more of this engineering, the physics, the science behind the actual light versus how it interacts with the body. Can you tell us more about that?
Yeah, definitely. So thanks again for having us on the show. We're excited for the opportunity. The science of light is really a very exciting field, and it's amazing the role that it plays in overall health. And I have a background, as you mentioned, in engineering, originally from Iowa State University a few years back. And anyways, I've been in that field ever since, managing project teams and helping to develop products that really work to the utmost that science can, we're basically pushing the frontier of what we can do. And what's been really exciting about what we've been able to do with Joovv is really take something that the science is there and then develop a product that really helps meet the needs of what people are really looking for a full body light therapy device.
Awesome. Yeah, thank you again for joining us. So let's talk a little bit more about this device. I've been saying red light therapy, but there are a ton of words that can be used to describe essentially the same thing. So would you go into the nomenclature around Joovv, what it is, if I'm saying it right even? Is it red light therapy?
Yeah, no, that's a great question. And as you mentioned, there are many names for it. Red light therapy is one, phototherapy, low-level laser therapy, which has been around for decades, or really what the new terminology that's being widely accepted is the term photobiomodulation, or PBM for short. But all of those terms really speak to one thing, and that is photons of light at specific wavelengths that have a pretty incredible impact on biological functions.
So what are those specific wavelengths?
Great question. There's actually been studies done on a wide range of wavelengths, everything from 400 nanometers on up to well into the near infrared spectrum, 11, 12, 100 nanometers. But there are a specific a handful of ranges that have been proven to be the most effective for most overall health, cellular health functions. So the first of which is in the mid 600 range, so roughly between 630 and 670 nanometers. And then again in the near infrared spectrum, in the 800 to 880 nanometer wavelength range. Both of those wavelength ranges have been proven to be very effective to help restore healthy cellular function.
And with the Joovv light specifically, what ranges are you using?
We use 660 nanometers in the red spectrum, and then 850 nanometers in the near infrared spectrum.
Okay, and I have to admit that I got mine and turned it on, and I was like, what? Half of it isn't working. What's going on here? Are these light bulbs like faulty? Did they burn out? What's happening? I also looked straight into it. Can I hurt my eyes doing that? Because it's a little painful.
Great question. So there actually is a robust amount of clinical data showing eye health benefits for both the mid 600 range and mid 800 range.
What a relief.
Yeah. So so everything from various types of degenerative eye disorders to even just overall eye vision quality, and so it's been pretty interesting to see that happen even just from our own experience. But to answer your question, if it's uncomfortable, it's a good idea to just start out the treatment with your eyes closed, and you certainly don't need to look directly in the LEDs, and then just kind of what feels comfortable to the eye.
And then the other piece about how some of the lights don't look like they're on.
Yeah, great question. And we get that quite often, as you can imagine. But the near infrared wavelengths in that 800 range are invisible to the human eye. So even though those LEDs are on, and you could put a meter on them and show you the energy that's being delivered, it's beyond what your eye can recognize as light.
Got it.
And Heather, just to circle back around to your second question with respect to the safety and eye health, as Justin mentioned, there's a lot of clinical data to support its use for vision and reducing or restoring conditions like macular degeneration. But it is important, and most legitimate device companies will have their products or devices in our case tested. Run through a myriad of different photobiological tests to make sure that the LEDs are in fact delivering safe light therapy for the eye. So that's just an important consideration for anyone that's listening and is has the same type of question or is evaluating different products.
And so for Joovv, you've done that.
We have, correct. As you can imagine.
Yes. So I'm curious. With the different wavelengths, is there different penetration into the skin? Should we be looking for different results from different wavelengths? If somebody is looking at getting a different device and they have a certain condition, would be more focused on one thing for oral health, one thing for nerve regeneration, one thing for hair growth? Like, how would we go about getting the best clinical effects?
Yeah, that's a great question. So on a cellular function level, both of the wavelength ranges I mentioned have a very similar response in terms of restoring cellular function, boosting ATP production, so forth. As you point out, actually there is a significant difference in the depth of penetration. In the red wavelengths, they are very effective for things like related to the skin health issues, so boosting collagen, and other issues, more, I guess, nearer the surface of the skin. The near infrared wavelengths are actually do a much better job of penetrating to deeper tissue. So things like reducing muscle soreness, joint pain, inflammation. So together, we strongly feel that both wavelengths are important, and that's why we use both wavelengths in our devices.
Got it. And then mitochondria you mentioned. So I'm curious about the mechanism here. What's going on exactly at the cellular level in the mitochondria that helps to increase the performance of the cell?
Sure, I can take that one. And the laundry list of benefits that you listed kind of in the intro to this this podcast, it almost sounds too good to be true. You know, everything from skin health to muscle recovery, reduced joint pain, enhanced mental clarity, et cetera, et cetera. It's almost like it seems like this could be a magic pill. But the reason for that is that because of the mechanism of action at a cellular level, more specifically at a mitochondrial level, it's because of that mechanism of action that you get this myriad, this wide-ranging list of benefits, because you're in essence helping your cells at that level, at the deepest level, produce more cellular energy, or ATP, adenosine triphosphate. And so that's why what sounds something that sounds too good to be true is actually, it makes sense once you kind of begin to understand the mechanism of action. And if Heather, if you don't mind, we'll probably get into the weeds a little bit here, and I'm sure Justin can speak to some of the physics of this here in a bit. But in terms of the mechanism of action, it's probably it's first helpful to probably understand or kind of go back to what most of us remember in high school biology class with respect to the 4 different phases of cellular respiration. The first phase being glycolysis, the second phase being pyruvate oxidation. The third phase being the citric acid cycle, sometimes referred to as the Krebs cycle. And then the fourth phase, which is really where the magic happens with respect to light therapy and photobiomodulation, is the fourth phase, oxidative phosphorylation. And within those 4 phases, if we really focus on that fourth phase, when our cells are functioning properly, there's this electron transport chain, which is really important in terms of creating this gradient on opposite ends or opposite sides of this of the mitochondria, right? You've got your intermembrane space and then your mitochondrial matrix, and you want not pressure gradients, but different charge gradients. So, as electrons move down this electron transport chain, the energy that's released from these electrons is used to pump protons out of a matrix. And that's what forms that charge gradient, and that's ideal. And through that process, you have this enzyme, cytochrome C oxidase, which I think you hinted at. That's really important because the chromospheres with that protein actually accept and receive specific wavelengths of light, specific photons of light. And so when our cells are functioning properly, cytochrome C oxidase actually helps bind NADH to form the necessary hydrogen ions to produce ATP synthase. And ATP synthase is a precursor to ATP. And so that's where the importance of cytochrome C oxidase can't be underappreciated in terms of producing the byproduct. The precursor to ATP and ATP synthase. So that's what happens when how our cells are supposed to function when they're healthy. But as everyone listening to this podcast knows, our cells are constantly under stress, whether it's intentional through exercise, whether it's unintentional through too much blue light exposure during the wrong times of day. There's a myriad of different reasons why our cells could be under stress, and when they're stressed, they produce excess nitric oxide, and nitric oxide actually competes with oxygen and then binds to cytochrome C oxidase. And because it binds to that protein, our cells can't produce the same amount of ATP synthase. And so sort of you begin to halt or limit the amount of energy your cells can produce. And so that's what happens kind of when our cells are under stress. And really, that's really where red and near infrared light in those specific ranges that Justin mentioned. That's where this really comes into play, because those specific wavelengths actually help excite the electrons that bind nitric oxide to cytochrome C oxidase. And by exciting those electrons, those bonds are broken, which then frees up cytochrome C oxidase to allow oxygen to bind to NADH, and then ATP synthase is formed, and then eventually more ATP is produced. And so that's what's sort of happening at a cellular level. But if I had to sum it up, it's really these specific wavelengths of light help break the bonds, the negative bonds between nitric oxide, excess nitric oxide, and cytochrome C oxidase. By breaking those bonds and freeing up cytochrome C oxidase to do what it's supposed to do, our cells then produce more energy, which leads to those that laundry list of benefits that you mentioned earlier. Everything from mental clarity to reduced joint pain to enhanced skin health, etc.
That's great. Thank you for explaining that. And I think just to put it in context, for me, I'm a naturopathic doctor. So when I see patients, I think we do a really good job focusing on the nutrients and the biomedicals or the biochemical side of things, whereas this is photobiomodulation. So it's like the chemistry and the physics that is the other half of the coin when we're looking at cell function. And Daniel and I, who's also here at Neurohacker Collective, you guys know him. So when we talk about medicine at kind of at a larger level, where does Joovv fit into that? So when we can enhance the ability of every cell in the body to function, then everything gets better, right? It's kind of like goes back to those foundations like sleep and a good diet and having regular daily bowel movements is my favorite, in terms of like reminding people how to get the toxins out, how to keep our cells like able to restore themselves, able to get the new cells built and the old ones out. All of that requires just taking care of the foundations. And there are a handful of products like yours on the market where you just elevate the whole conversation, so to speak, in the body around that function. I think the other piece here is, not only are you elevating regular cell function, but you're restoring function when there is some sort of perturbation, like a toxin, like you were saying, like stress of overexercise or a divorce, whatever it is on the spectrum of things that happen to humans. Whenever there's this perturbation, we lose some cell function. Even aging, we can lose some cell function. And so I feel like in my practice, we do a good job covering the basics in terms of nutrients, but not always a great job optimizing the function of the cell at this level. So I'm so excited to have the Joovv light because you guys are doing that hard work for me. And then also thank you for explaining how that fits in, like how is this working? That it would be just as important as getting good sleep and having a good diet. So
yeah.
Oh, go ahead.
I was just going to say exactly. I think that's one thing that's easy for many of us to forget is just the importance of light for overall health. We tend to think of, as you mentioned, the nutrients that we ingest in our body, but we kind of forget about the nutrients in the form of light that we basically have our ancestors that were receiving for thousands of years, being in natural sunlight all the time. And the most recent numbers that I've seen is, in the U.S., for example, we spend approximately 93% of our time indoors and away from sunlight. So we're basically starving our bodies from those nutrients, and that's why I think photobiomodulation has such an incredible promise for people that are really in need of those benefits that they can get from light.
The sunlight. Thank you for bringing that up. I'm curious about Joovv and red light therapy versus sunlight versus blue light that we might get from electronic devices. Can you go into the differences between those?
Yeah, that's a great question. So obviously sunlight has a wide range of wavelengths, everything from UV spectrum to 300-400 nanometer wavelengths on up into near, mid, and even far infrared wavelengths. So you have wavelengths in the, say, roughly 3,000 nanometers where you have a significant amount of heat delivered, for example. So one example of that, or how I would describe that, is if you're outside on a sunny, hot day, you can feel that heat just radiating from the sun. And interestingly, water absorbs those wavelengths very quickly. So if you have a cloud pass by, you'll notice that it feels just like that heat got shut off. That's because those mid and far infrared wavelengths that are delivering the heat have just basically been blocked or absorbed by the water in that cloud by in a large portion. So whereas the visible light and even the shorter near infrared wavelengths are still penetrating down to your body. So those are the wavelengths that as we talked about have a big role. I'm
getting excited because now I have the question of like, okay, so if you jump out of the shower and you're wet and you stand in front of the Joovv light, are you going to get less benefit?
Well, you dry off fairly quickly. There is just a very slight warmth from the wavelengths in the Joovv light. But yes, theoretically, if you were basically covered with like really any type of say lotion or anything that would theoretically block some of the wavelengths, you're best off to have do the treatment on bare skin. So we sometimes people ask, well, are you supposed to be naked when you do the treatment? And the answer is, well, at least the area that you want to that you want to receive the benefits. Yes, you want that area bare.
So as close to naked as is appropriate for the situation.
Yep. Exactly.
Continue with telling me the differences. Like sunlight, would we also call that full spectrum?
Yeah, certainly. So there certainly is a wide spectrum or full spectrum light is included in sunlight. Photobiomodulation basically takes a specific role that is included in the wavelengths of the sunlight that have these particular benefits that we're talking about. So photobiomodulation, we're able to take those wavelengths and deliver them in a high intensity treatment to basically help make up for what your body, is not receiving in sunlight. So we're big proponents of getting as much natural sunlight as you can. But as I mentioned, statistically, most of us in just with our modern lifestyles aren't able to get the amount of sun that we really should. And even if we do get a decent amount, there's still benefits that you can get from photobiomodulation, obviously.
Okay, so it wouldn't be a replacement for getting outside and getting good sun, but it could be a supplement. Augmentation.
Yeah, that's a great way to look at it. So obviously we don't have UV wavelengths in our devices or in most devices that are considered photobiomodulation. So there's benefits in UV wavelengths, obviously, for vitamin D production, for example. But certainly for the stimulation and restoration of healthy cellular function, photobiomodulation can be a great way to help supplement your body's light intake.
And it seems like with UV, there's also risk associated, cancer and oxidative stress. And so you skip that, I'm assuming, with Joovv, right?
Correct. Yeah, there's no UV wavelengths. There's no danger of getting a sunburn or suntan or some of those, as you mentioned, some of the harmful effects that can come with specific wavelengths of light.
Okay. And then what about blue light therapy? How is that different from the red light therapy?
Great question. So there is obviously studies that have been done using blue wavelengths. Their primary role in photobiomodulation is around acne because of their ability to basically kill microbial organisms in the skin. There also is some dangers with that as well because of the detrimental effect that they can play on different other cellular functions. But yeah, to answer that question, there definitely is, there are some interesting benefits in using blue wavelengths. The other kind of aspect that I would mention of that is specific wavelengths that we take in through our eye, for example, being on computers and devices all the time. Those kind of play a different role where now you're talking about your circadian rhythm and how that can throw off, your hormone production and things like that.
So generally, we want to be avoiding blue light. It's not therapy. It actually can be detrimental. And then we want more of the red light spectrum, and it's specifically those. Go ahead.
Yeah, exactly. And like I said, there's a role for photobiomodulation using blue light, but it's something that you want to be, very well educated in using a device that's, I guess under close supervision, so not something that you want to just go experimenting on.
And it sounds relatively limited, versus the red light therapy, which is pretty expansive. I mean, it's hard to name something that doesn't seem like it helps.
Exactly.
Yeah, and Heather, just to add to that, it's pretty well understood in like the dermatology community that blue light is really just used for bacteria-induced acne. But most I guess most practitioners that are going to treat skin with that fashion kind of understood that you really want to follow up or use red light in conjunction with blue light for its restorative benefits too. So blue light alone usually is not the greatest sort of therapy, but if it's used for acne or for bacterial-induced acne, it's probably best used before red light or used in conjunction with red light.
Got it. Thanks for clarifying there. And then
Sure.
When I was in school, I had the opportunity to see some lasers, some cold laser, low-level laser, I think is what we called it. It didn't get hot, but there was a patient, one of the first patients I ever saw as a student. It was so cool because he came in and he had a laceration. He had a cut on his finger, and he also had trigger finger. And so we were using it on both. And just kind of like to experiment, because here I was in school, I was like, what is this? This isn't going to work. And the guy kept coming back week after week, and he was like, look, it's healing so much faster, and my finger's better. And the trigger finger took a little bit longer, but the scar, he had no scar. And I think I saw him over the course of 10 or 12 weeks, but he had no scar. It healed really, really quick. And so when I saw what you guys are up to, and I thought about laser, and laser, you know, he used it on his finger because the laser is so small, it can barely, you know, you can't really cover much surface area with it. And then with what you guys have, you know, mine is how tall is it? It's like 4 feet tall. It's taller than me when you put it on the stand and everything. So it covers my entire front half of the body, back of the body. You can really cover a lot of surface area with it versus a laser. So can you tell me, is that the only difference, or is there more to it than that?
In a nutshell, you hit on one of the big benefits for a full body light therapy device. I would we'd owe a lot to the original science and studies that have been done over the past few decades using low level laser therapy, because it was really the proving grounds before LEDs were really to a point where they were optimal for the therapy. But basically what used to be used for photobiomodulation was almost exclusively lasers, or as you point out, either sometimes described as cold laser or low-level laser therapy. And so using that, I mean, they found it was very effective for a wide range of different health conditions. But basically what really came about in the mid to late 90s was the discovery that LEDs could be just as effective as lasers, only now you can have a much larger treatment area. And I think that the way that when it kind of clicked in my head a few years back is essentially your body doesn't care and your cells don't care. The technology that was used to create the photons that they're absorbing, really the only things that matter are the wavelength and the intensity of the light. And so that's what the benefit is of using LEDs, is you can have a very high intensity, which is one of the things that's extremely critical. And there are a lot of devices on the market that they may use the correct wavelengths, but if the intensity isn't there, they're not going to be very effective. So anytime you're looking at studies of photobiomodulation, you'll notice they'll either give you a total dosage in terms of joules per square centimeter, or they'll talk about the irradiance in milliwatts per square centimeter. So if you're an effective dose, what we basically, our aim is to provide 100 milliwatts per square centimeter for about 10 minutes. And at that rate, you're going to get about 60 joules per square centimeter, which is a very effective dose especially for reaching deeper tissue.
Great. So I have two directions I want to go in this. One is, you said your body doesn't care who's emitting the wavelength, just that it's that right wavelength. And then there's a couple other parameters. I think what I noticed, because that low-level laser that we used when I was in school was, I think it was $10,000 or $15,000 for this little device. And so your pocketbook gives a shit, right? Like it is going to be a whole lot less expensive to get a Joovv light that's made out of LED, just as effective. And then you can, or actually more effective because you can cover more surface area than it was to get the lasers that were available in the 90s and early 2000s. So I just wanted to sort of make that point, and maybe you guys can speak to that too, just like how much more cost effective it is these days to be creating these devices. And then the other thing I want you to go through, because this gets super confusing for me, is just what are the parameters that anybody who's looking into this should be looking at? So you've mentioned wavelength, you've mentioned irradiance, you've mentioned dosage, you've mentioned intensity. Power is something else that seemed to come up when I was doing my research before purchasing the Joovv light for the clinic. And so I don't even know if I got it right, but I think so, based on what you guys are telling me today. But what are all of the things that someone would want to take into account when they're looking for a red light therapy device?
Yeah, I mean, you hit on the core factors there. Probably the one that obviously everyone cares about is the financial impact. And as you point out, it's got to be something that's cost effective for people to add to, as a reasonable investment for their health. And I think that's one of our goals from the very beginning of Joovv is to create a device that everybody can use in their own home. Ideally, light therapy and photobiomodulation is something you do on a daily basis, or at least 4 to 5 times a week. So if it's something that you have to pay to do a service at a clinic, while that's it's better than not doing it. Ideally, it's something you could do in your own home. So the price obviously matters, and then as you pointed out, the size of the treatment area is incredibly important. So if you can get the benefits that help you increase the collagen production in your face, well, that's good. And there's a lot of products in the market, especially the like handheld type devices where after multiple treatments you can do your whole face, but how much better that you could do your whole body, and now it's not limited to just your face getting these benefits. So the area is huge, and then finally it's really it comes down to the irradiance, which is just the light output, and sometimes called photon flux, but it's literally just a measure of the amount of energy that's passing through a given area. So when I mentioned, by milliwatts per square centimeter, it's literally the power output of the photons of light that are hitting your body. So that basically is the rate of energy. So the 100 milliwatts per square centimeter squared, for example, equates to about 6 joules per square centimeter per minute. So that's basically just the rate of energy transfer. And with an effective dosage or with an effective intensity, then you're not having to spend hours in front of a device, because no one has time for that. So our at that intensity, it takes just 10 minutes is the recommended treatment time to get an effective dosage.
Great. Yeah. So I know it probably depends on what you're treating, like if it's joint pain versus acne versus psoriasis or hair growth. But tell me, how do you typically recommend using the device? What's the optimal dosing? When should they do it during the day? How long? What does all that look like? What are the practical steps that we'd want to take?
Yeah, no, excellent questions. And there's a lot about light therapy that really depends on the individual. So whereas one person's body might respond one way, another person might say, hey, I'd like to do it 12 minutes or 15 minutes. But a general guideline is about 10 minutes, roughly 6 inches away from the device, and that works out to about 60 joules per square centimeter. So in terms of time of day, probably ideal, just because it would replicate the wavelengths in natural sunlight. Ideally, you would be doing a treatment fairly early in the morning, say early to mid-morning, or in the evening. So when you also have a lot of red and near-infrared light in sunlight would be in the evening. But that being said, there's really no harm in doing the treatment during the middle of the day either. As there's certainly those wavelengths in natural sunlight during those time frames as well.
There's no risk that it'll interfere with sleep. Oh, excuse me.
Oh, go ahead.
Yeah. No, that's a great question on the sleep. But there's most people find it extremely relaxing and do enjoy doing a treatment near right before bed.
Scott, sorry.
Yeah. And no, just to add to the sleep thing, I was going to come back to a comment about irradiance, but with respect to sleep, that's probably I'm not an overly sensitive person. So like my wife, for example, may pick up on something, the energy from something a lot better than I could, but that is one of the benefits that I find most compelling or most obvious when using light therapy is in the evenings. If I pop that baby on for 5 minutes, even if it's just to illuminate our room at night, it definitely sort of lowers my or sort of readies me for sleep for sure. And that's a similar comment that we hear quite a bit. But in fact, there's a clinical study that's been published. There's several actually, but one in particular is on a group of female basketball players that used red light therapy before sleep, and it actually led to significantly better sleep quality when using it. So there's definitely clinical data to support that as well. But kind of coming back to the the topic of irradiance, that's really, really crucial, and it's most people. it's a concept that's somewhat hard to understand at first blush, but it's really important. And I always like to use the comparison that if you're trying to monitor your macronutrient intake per day, right, if you know that you need to get a certain amount of protein, certain amount of grams of protein per day, or a certain amount of carbohydrates, when you're consuming something, you're looking for those macronutrient parts, right? If you're looking on the side of the product, for example, you can make a similar. There's a similar analog when it comes to light therapy. If you're looking for just skin health, most studies, most clinical published research suggests that you really only need about 5 to 10 joules for a clinically relevant dose of energy. But when it comes to muscle recovery and joint pain, or really deep tissue treatment in general, you really need more along the lines of 50 to 100 joules of energy for it to be clinically relevant. And so by knowing sort of those core principles, it allows you to go back to the device you're using and calculate how long you need to use it. And so that's why understanding the irradiance the power, whether it's photon flux or irradiance that's being emitted from the device, is really crucial, because that allows you to calculate how long, calculate the dosage, and really to be pragmatic, how long you really need to use it. So those outlines that Justin provided are kind of specific to our devices. But if you're using something that's lower power, you're going to need to use it probably a lot longer, sometimes 10 times longer, to receive a dose of energy that's clinically relevant.
So just to clarify, because I'm not sure I got this all, you said 60 joules per centimeter, right, Justin? And is that over a certain amount of time? Is that over the 10 minutes, or is that at every moment that you're standing there, you're getting 60 joules per centimeter? How do we calculate this?
Yeah, so irradiance is the rate of energy transfer. So it's 100 milliwatts. So you think of a watt of energy, you're getting a tenth of a watt over every square centimeter. And then that would translate to a dosage of about 6 joules per minute. So if you take that times 10 minutes, then that's how you arrive at 60 joules.
I see. And Scott, you said that you want to aim between 50 and 100 to get a clinically relevant benefit. And so that's how we get there. I'm with you. So if you were there for 12 minutes or 15 minutes, you would get even closer to that 100.
Yep,
Correct.
Exactly. Yep, okay. Exactly. Yep. And then if you're just interested in benefits for skin health, you really don't need to use it for that long. Most of our customers do kind of use it for that 8, 10, 12-minute time frame, just because they're looking for benefits beyond just their skin. But theoretically, if you just want to reduce wrinkles or something along those lines, you really only need to use a device like ours for about 1 to 2 minutes to receive clinically relevant dose. So it kind of depends on what you're aiming to treat, but generally speaking, that's why we recommend anywhere from 8 to 12 minutes with our device, just because that's gonna be pretty universal or pretty applicable to almost everything you want to see benefit from.
Got it. And then how long should I be using it? Should I be using it every day? Should we take days off during the week? Is 3 days a week going to do it? How frequently should we be dosing this?
Ideally, it's a daily treatment. We're like, as Justin mentioned earlier, we're big proponents of getting light on a daily basis in general, and most people, myself included, don't spend enough time outside. I'm outside right now just for this podcast, but even for someone that's deep into this space, I have to be intentional about getting enough light. So that's why, generally speaking, we recommend a daily treatment. But ideally, 4 to 5 times per week is great. This is not a type of therapy that you can be inconsistent with. So doing treatments once a week is really not, you're not going to really probably see a whole lot of benefits from that. It's really something that you need to be consistent with.
And then when will people start to notice benefits? And I'm sure, again, it depends on what are we trying to treat, but is it a week, a month, 6 months?
Yeah, that's a common question that we get, and the answer really depends on the individual and the types of benefits that you're looking for. We do have a lot of people that after very first treatment, they notice that they sleep better, or that the joint pain that they've been had for a long time is significantly improved. But other things that have more of a cumulative effect, things for example, like collagen production in the skin, your wrinkles aren't going to disappear overnight, unfortunately.
Dang.
So some of the things like that, where it takes consistent treatment. But I will say that most people within a week or two find themselves gravitating towards the light and wanting to continue using it, even if they can't maybe put their finger on exactly why. I think most people find that it just feels good. I mean, your body was made to be fed by light, if you will, and I think most people can sense that and feel benefits. And it after enough time period, maybe it's 1 month, maybe it's a little bit longer. Most people also can see some differences, whether it's overall skin health. Sometimes that I think for guys especially, you don't tend to think about it too much, but I remember when I first really started using it. My parents lived out of state. I hadn't seen them for I think it was a month and a half or something like that, and they could not believe how good I looked. Basically just overall skin health. Not a lot of wrinkles, just look young, vibrant, and that's something that I think just about everyone notices after doing it for several weeks anyways, but that's certainly a common benefit.
Just having a generally healthier appearance, probably because, like we were talking about, you're just elevating the function of every cell in the body. So one thing that comes up with a lot of medical devices, your experience, that there's always like some contraindications. Some people that either would be at risk or wouldn't benefit. So pregnancy, implanted devices, cancer are really common ones. Can you speak to that? I mean, are these, because we are elevating the function of cells, maybe that doesn't apply in this case. And then again, maybe it does. Can you just speak to who would want to be really careful about applying red light therapy?
Yeah, no, that's a great question. There's a lot of different ways to go with that, but as you point out, the every indication from the studies and the science is that there would be benefits for even people that were pregnant. That being said, there are some places where we just don't have the scientific data to say it's absolutely safe for this. In those cases, we just have to reference, this would be something that we would recommend consulting with your physician. But specific, I'll just kind of address the pregnancy one, for example. In our discussions with Dr. Michael Hamblin, who is widely renowned as the world's expert when it comes to photobiomodulation at Harvard, he's participated in, I used to say over 300 studies. I recently saw now it's up to over 400 clinical studies, but he is actually believes that it would be quite beneficial for the baby because of the sensitivity that those cells have to photobiomodulations, the stem cells. So there's just a lot of interesting things there, but it's some that's just yet to be determined by the science.
Well, and Heather, just to add to that, I mean, that's probably an area, like when it comes to pregnancy, you're probably never gonna have definitive published literature, just because it's gonna be so difficult to enroll patients in that. I mean, which I'm not sure if you have kids or not, but what name a pregnant mom that's willing.
I'm pregnant right now.
You are.
I'm like,
okay.
I don't want stretch marks. Can I go stand in front of this thing?
Yeah. Well, you're maybe I shouldn't have posed that question to you. You'd probably try it for sure. But most moms aren't going to enroll themselves.
Well, to be honest, I haven't. I've stayed out of the room because I'm conservative, like as a practitioner, but also, and there are 2 other girls in the office who are pregnant too, and all of us are, we're chomping at the bit to get in front of it, to get rid of our wrinkles and not get stretch marks. But I do have some concerns, and I think it is one of those places where. It just depends on your personality, how risk averse you are. And certainly with the baby, it's so hard. You don't want to do anything that might put them at risk. So I've stayed out of there, but I can't wait to get in there.
But as Justin mentioned, though, because that's why Dr. Hamlin fundamentally believes, although it's a theory, that light therapy during pregnancy would be so beneficial because of the overabundance of stem cells, and stem cells are loaded with mitochondria. So in theory, it almost should work better, with right. For mom and baby. But yeah, it's one of those things that if you're a practitioner and looking for clinical data, you're going to be hard pressed to probably find any study ever that's published with respect to pregnancy and photobiomodulation, just because of the enrollment piece. But yeah, I mean, it's weird. Like, just to kind of go circle back around to your question at a high level, photobiomodulation, light therapy, it's one of those interesting arenas that it's really hard to find any contraindications. Unlike other medications, drugs, etc., you usually find a laundry list of things. But light therapy, you're really just harnessing certain wavelengths certain wavelengths that are found in natural sunlight, and using those to your benefit. So there really isn't really a whole lot of contraindications other than the obvious, right? Pregnancy wouldn't be a contraindication, but you're just not going to find hard clinical data to support it either way. If you're taking photosensitizing drugs, that would be another one, right? Something, a drug or medication that causes photosensitivity. It would be extremely rare, but that would obviously that might lead to some type of rash in that case if you're consuming some type of medication like that. But by and large, there's really not a whole lot of downsides, if any, to point to when it comes to light therapy.
So somebody with a pacemaker, an IUD, or implanted device, artificial joint, they don't have to worry about that heating up like you would with other devices or even certain machines. And then with cancer, can we talk a little bit about that? Because I feel like that's kind of a gray area, just like pregnancy. If somebody has cancer, can they use this?
Ooh, that's a that's a tough question. So we're not doctors, and we certainly don't play them on Skype either. So we would say, if you go to North County,
North County Natural Medicine, yeah,
we would say consult with your practitioner there. But there is some really sort of I think as Dr. Hamlin recently called it in a publication that we co-authored with him, some pretty tantalizing evidence with respect to light therapy and photobiomodulation. Because as it stands right now, you can find studies that support its use in oncology patients and studies that maybe show enhanced tumor growth at a very localized level. So right now the clinical data kind of goes both ways, but there is some recent research that suggests full body light therapy is actually extremely beneficial because you're in essence enhancing your immune system. You're helping it transition from an M1 phenotype to an M2, which helps your body actually metabolize cancerous cells naturally. And so there is some really interesting questions, but I don't think I'm going to speak for Justin here. It's hard for us to provide definitive guidance. One, because we're not practitioners, and two, we don't want to get into legal trouble.
Sure,
so the default question in that scenario is obviously consult with your practitioner. But I would throw a caveat on there: consult with a practitioner that sort of understands light therapy, or has some sort of understanding of it, just because most don't, as you probably know, whether they're traditional MDs or DOs or naturopaths like yourself. This is a new space, so consult with your practitioner, but, try to consult with practitioners that are somewhat knowledgeable about photobiomodulation.
Yeah, I think this is such an interesting conversation because the literature isn't clear, right? So we really don't know, and it would be up to the individual to decide and yes, discuss with their provider. And yet I can see so much potential benefit, and especially if you're someone with cancer who's really looking for alternative therapies that can help enhance the function of every cell in the body, whether it's an immune cell that's going to go out and target that cancer, or nutrients, how you absorb nutrients relies on gut cells, right? So making sure that you have enough nutrients and the right amount of iron, all of these things, not having too much sugar, all of these things really depend not only on what you choose to eat, but on how well your cells function. And if something like the Joovv light can help with that, then I can see it being really beneficial potentially. But it does sound like there is just this big question mark around it. And then to your point,
Just to add to that real quick, just to kind of be pragmatic is, I had an aunt that recently experienced this as well, but, undergoing chemo treatment. But there is a robust amount of clinical data, and almost across the board, you're going to be hard pressed to find something that goes against this opinion that when it comes to oral mucositis, which is a kind of a negative downside to people that are undergoing chemo. Or radiation, it's actually the incidence is actually extremely high, especially in head and patients that are undergoing or that have head and neck cancer. But across the board, photobiomodulation has been shown again and again and again to have significant results when it comes to both treating oral mucositis as well as preventing it, without it leading to other issues regarding the cancer cells in and of themselves, like growing and whatnot. So there's really, really solid data to support its use, but there's you're gonna find the handful of clinical studies that are where that don't showcase that, and cancer is just one of those topics that it's it can it's very sensitive to say the least. And so,
Sure.
but there is I don't want to underappreciate the amount of clinical evidence that suggests that it does work, but it's one of those things that you're always gonna have sort of a division in sort of the clinical community as to using photobiomodulation for your patients, oncology patients.
Got it. So let's move on to some of the other places where there's really robust literature in terms of what we might be treating. So we've talked a little bit about optimization, but also we've mentioned skin a handful of times. So I'm curious, eczema, psoriasis, acne, wrinkles you've talked about. What about hyperpigmentation? I really have a big question around that one.
Yeah, that's a tough one because and it's one of those things, it's actually a nice segue. It's one of those topics that where the clinical data showcases both sides of the equation, so to speak. So there's plenty of evidence that suggests red and near infrared light, more so red light, helps with hyperpigmentation issues like melasma, for example. But there's also other clinical studies that showcase that it actually leads to more hyperpigmentation. So it seems to be very, very individualized, very, very personal to the individual patient when it comes to those types of issues. At a high level, we generally would probably, if someone's dealing with hyperpigmentation, and my sister is an esthetician, she runs her own med spa, and this is kind of her algorithm as well, is that generally speaking, she'll use red wavelengths alone, not near infrared, because near infrared lights can stimulate melanocytes to produce more pigment. So she'll generally use red light alone, especially if someone's dealing with hyperpigmentation. But again, the evidence kind of goes both ways. But the safer play would probably be to use red light alone in those types of situations.
And then with the rest of the gamut of skin conditions, what are you guys seeing?
Yeah, I mean, the evidence across the board is, you just named it, psoriasis, rosacea, eczema. The issues go on and on and on. Just do a simple PubMed search for PBM or LLT using kind of those common acronyms, and insert your skin condition. You'll find loads and loads of either clinical, individual clinical studies or meta-analysis that where the researchers curated a collection of 50 plus studies that looked at various skin conditions. But you name it. You name the traditional academic institution, whether it's Harvard, MIT, et cetera. You'll find clinical studies that support all of those issues when it comes to light therapy.
Cool. And so with this, I think you guys mentioned that this was on more the red light side versus the near infrared side. So that's when we're talking about that 620 nanometers, right? Or closer to that, 660. Is that where we are?
Yeah, we're at 660.
And so those are the ones that are going to penetrate the more the surface tissues, so the skin. And then are we getting collagen production there? And you also mentioned, Scott, I think that you could get away with doing it for a little bit less time if what you're doing is just targeting the surface tissue.
Yeah, correct. So the mechanism of action, with both wavelengths, whether it's red in that range that Justin mentioned earlier, whether it's kind of that 630 to 670 range, or the near infrared, which is kind of in the low to mid 800 nanometer range, anywhere from like 810 to 860 or so, the mechanism of action holds true. So that enzyme I mentioned earlier, cytochrome C oxidase, will absorb very readily those two wavelengths in those two ranges. But the difference comes down to kind of penetration. And so near infrared light in that range will penetrate a little bit deeper than red wavelengths. And that's why when you look at the clinical literature, most of the time researchers that are studying light therapy for skin health will use red wavelengths in that range that we just mentioned, whereas clinicians or research that are studying things like joint health or muscle recovery or athletic performance or cognitive function, they'll use, generally speaking, near infrared wavelengths just because their ability to penetrate a little bit deeper. But when it comes to skin health, yeah, most of the clinical studies, you don't really need a very high energy dose to see benefits. You usually need a little bit longer time. So most of those studies are over the course of anywhere from 8 to 16 weeks. So generally speaking, you need a little bit more time. But the power is most of the time the energy dosage that's used on the subjects in the studies isn't as high as those that are in those trials or those studies that are being where light therapy is being used for muscle recovery or joint pain or inflammation and stuff like that.
So on the subject of skin, in my office, if somebody comes in with a skin complaint, I start to look inside. So I'm thinking about detox because the skin is one of our largest detox organs. I'm always going to be looking at liver function, bowel function, kidney function, and then lung health as well, because we do expel a lot of toxins through our breath. So with skin issues, I often am suggesting that someone get in the sauna to help to get, toxins eliminated more efficiently and effectively through their skin. How might you, and I have to admit, we have the Joovv light in our biohacking room with a sauna, and we combine them all the time. Am I doing this wrong?
That's a good one. So I have yet to see a study that actually shows both the photobiomodulation and sauna treatments conducted at the same time. It would be extremely interesting to see because the function at a biological level is different between the two therapies, and they're fundamentally different because of the wavelengths that are used. We are of the opinion that the best recommended protocol there would be to do a sauna treatment and then let the body cool for a few minutes and then do the photobiomodulation. So it's kind of like you could run a marathon and eat lunch at the same time, but you may not want to. You might be better off to actually give your body nutrition to undergo the stress before, and then give your body some more nutrition afterwards to help it recover. So that's kind of the logic behind that. But as I said, it's something that's really yet to be substantially studied.
Well, thank you for that clarification. That's helpful. And then recovery. So you just mentioned a marathon. So somebody has run a marathon, or they're training for a triathlon, or they're lifting a lot. What do we see when it comes to recovery? One of the articles that I had a chance to look at really interested me, because the question at the end of it was not whether or not it was beneficial for recovery, but actually like whether or not it should be legal when it comes to competitions, whether or not anybody competing should be allowed to use the red light therapy, because it gives them such an edge over everybody else. It's like taking testosterone or doing something like that, where they're doing so much biohacking, I guess, that it's just not fair. So can you speak to that a little bit more? Again, like the mechanisms, what's going on, how it would be used practically, how often, the dosing, all of that in the context of recovery, muscle recovery.
Yeah, I think you're referring to a recent meta-analysis where Dr. Hamlin, we mentioned him several times now, I think was one of the authors on that publication, if my memory serves me right. But the researchers, I think, analyzed hundreds. I think if my memory serves me right, it was well over 200, and then sort of narrowed it down and ranked certain studies based on how structured they were, and came up with this curated list of I believe like 80 some odd studies that looked at muscle recovery and or athletic performance. So it's a really well done meta-analysis. But it's interesting because most people probably listening to this still are under the presumption that light therapy is sort of out there. It's this little bit woo-woo, not well understood. But yet the researchers in this with this particular meta-analysis sort of came to that conclusion that like we're well beyond the point of trying to prove whether or not this works. Should it be outlawed for the purposes of certain sanctioning committees? So it's kind of an interesting question. But to sort of go a little bit deeper, there's plenty of evidence that suggests light therapy is beneficial both before training, as to help induce better peak performance, as well as after training for sort of recovery mechanisms. I would say the one caveat, it seemed like most of the research when light therapy is used before training, you need a certain amount of time actually before you actually see benefits. So if you're let's take an Olympic power lifter, for example, he or she is probably best served to use light therapy a couple hours actually before the training. That's where it seems like most of the clinical evidence suggests you see the significant amount of benefits if there's a little bit of a window before using it. But across the board, in terms of using it as a recovery tool after, I mean, there's so many studies that showcase its benefits as a recovery tool. It's too hard to. It'd be boring going through all of those during this, in this conversation. So the evidence is overwhelming. We've got a couple articles on our site on Joovv.com, but if you use PubMed as sort of your foundation, you're going to find an endless number of studies that support its use for those two things.
Yeah, it used to make me a little angry when people would come in, either patients or I'd be talking to medical doctor colleagues or something, and they would have this like, oh, well, there's not enough literature, there's not enough research behind it. And now it makes me a little sad, not angry anymore, but I'm just like, oh my gosh, like you are so misinformed, because there is this insane amount of literature about how effective it is. And this isn't not just for red light therapy, but so many of the alternative therapies. And for whatever reason, the word doesn't get out. And I'm grateful to you guys for you've really enlightened me in terms of how much clinical evidence there is to support the use of this. And it's so safe, it's so accessible. And really that's my goal in my clinic, is that I've purchased one, not only so that I can use it after I'm not pregnant, but also so that, other people can at least try it out without having to invest too much. They can get a sense of like, yeah, this does make me feel better. Yes, I do see some benefit, and then decide to make the investment in something like this that they could have in their own home and be using even more regularly.
Yeah, and Heather, just real quick to go back to your point, there's over 3,000 published pieces on PubMed with respect to photobiomodulation, and there's over 200 double-blind randomized controlled trials just on light therapy alone. So if anyone questions the scientific evidence, you're right in saying they just haven't done the legwork, because it's relatively easy to find if you're just willing to do a little bit of diligence.
Right, and these studies are not like a handful of people once. This is these are really good, big, long-term studies. So yeah, I've definitely been impressed with the literature that's out there on this. So another application is nerve regeneration. So can you speak to that a little bit? How you would want to apply it? What you've seen? What it'd be good for?
Yeah, and I don't have the specific studies in mind. We could certainly, if you want to include those in the show notes, we could actually point to a few studies on PubMed specific to nerve regeneration. But that's a super interesting space. I would say, I think it's pretty safe to say that there in terms of the sheer number, there's not as many that showcase or demonstrate the benefits of light therapy for nerve regeneration as, say, like muscle recovery or athletic performance or even skin health. But there are definitely that are pretty compelling that show that these specific wavelengths of light in these same ranges actually do help your body generate new nerves or repair nerves, which is really interesting. But it kind of all goes back to that same mechanism of action that we discussed earlier. You're in essence allowing your cells to produce more energy, and so one downstream positive effect would be generating new tissue in the form of nerves, not too dissimilar to generating new muscle tissue, or something along those lines. If that makes sense.
Yeah, absolutely. So in my clinic, we do a lot of neurocognitive work, and as much as I want people to like not have wrinkles and look amazing, and that's good for your psychology as well, what I'm really, really excited about, and the same at Neurohacker, that's part of why I serve on their medical advisory board and why we've partnered, is that really what we're about is how do we help people reach their optimum potential. And a lot of that happens with what is your brain function. Like if you are depressed or anxious, or you have cognitive decline, or any of the myriad of mental health disorders, then you really can't engage with your communities, with your family, with your work in the same way that you can if that is optimized. So can you speak a little bit to how this can have psychological benefits or certain other brain disorders that you've seen the Joovv light be beneficial with?
Yeah, I'll just jump in on that too for a minute, but yeah, there's a wide range of benefits. We've touched on some of them, everything from mental clarity to stress reduction. And there's actually a pretty decent amount of evidence to show some benefits for Alzheimer's patients, for example. So going back to another Dr. Hamblin reference, but his actual favorite use for photobiomodulation on himself personally is to treat the brain for those wide range of benefits. I guess similar to the previous question on nerve regeneration, I don't have a specific study in mind, but there is a robust amount of evidence for a wide range of different cognitive and brain function benefits.
Scott, do you have any ideas about how you would do that? Would you would you focus it on like the brain, on the back of the head, on either side, on your forehead? Like, would you get it closer? Would you need to change the treatment or the way that you dose if that was your goal, was to enhance cognitive function?
Yeah, I would probably say any of those ways are probably beneficial. I think receiving these wavelengths of light through your retinas is incredibly important to help balance your hormones. And that's one of those areas that we haven't touched on yet. But light therapy has been shown to help with thyroid function. One of the ways in which it does that is through or by receiving these wavelengths of light directly through your retinas. But Justin mentioned Dr. Hamlin. He just simply shines our device, that all near infrared light device, right on his forehead. So I don't think it's probably that big of a deal which location. But just it's just the idea of treating your brain consistently would be probably most important, not necessarily the location.
And particularly the thyroid you've mentioned. So I would imagine that would help with metabolism, weight loss, mood, certainly dry skin or brittle nails. These are all, even hair loss, are all things that come up with both Joovv, but also with hypothyroidism. So if you can improve the function of the thyroid, you're going to get benefits across the spectrum of those conditions. And then tell me a little bit more about the testosterone application. So fertility and sex hormone balancing is another thing that we get a ton of questions about in the clinic. So again, how would we use this? I know that there has to be some direct application.
Yeah, no, that's an interesting one, and there's certainly a lot of interesting science that's been conducted that seems to be very promising in the field of, in terms of the impact that photobiomodulation can have on testosterone production. But some of the studies have been done where actually the light is shined on the testes. And I tend to think, as you mentioned, with overall hormone function, related to the thyroid gland, hypothalamus, I think, overall treatment of the entire body, if you compare the two, I think would prove to be even more powerful. So, basically, as what's been demonstrated is that specific wavelengths of light have been shown to help regulate these body systems and help them, return to a healthy, normal level.
At a really high level. So at the brain level, there's a re-regulation, it sounds like, of all of the sex hormones, thyroid hormones, stress hormones, I would imagine, are in that basket as well.
Exactly. I mean, anything that really disrupts the body's normal function, stress being one of those. We touched on some of the other things, whether it's blue light, toxins in the air we constantly breathe, or the food that we eat, or the water that we drink. All these things put stresses on our body system. And if we can really do some things like photobiomodulation that can help restore those functions, then it really just helps bring everything back into alignment, to where your body's not constantly in this fight or flight mode, but it can actually go into the repairing and healing and restoration of things that need to get taken care of.
Who wouldn't want that?
Just anecdotally, Heather, there's a practitioner that we work with based in Scottsdale, Arizona, Dr. John Toma. He's kind of a functional medicine practitioner, probably similar to your practice, quite honestly. We recently visited him, but he was showing us his blood work. And this guy is he looks like the epitome of health. I mean, he's like 6'2", 220, probably, 6 or 7% body fat. Although he doesn't do CrossFit anymore, he was at the time doing, he's an avid CrossFitter. The guy's Jack does all the right things, right? I mean, follows all the right, the right, systems, whether it's, his nutrition, shutting off all artificial light at night, et cetera, et cetera, et cetera. But before using light therapy, he's always suffered from low testosterone. And I think his levels, I can't remember he had LabCorp. He had, LabCorp, he routinely gets his blood work, but I think it was in the mid 200 range, his free test, I believe. Yeah. No, I'm sorry, his total test, his free test was in the threes, I believe. But after 3 months of using light therapy on a consistent basis, his overall testosterone went up into the 800s, and his free test, I think, went into the 9s or 10s, I believe. And then after another 3 months, his overall testosterone was I think 11 or 1200, and his free testosterone was, I think, 17 or 18. And this guy, well, he wasn't doing anything different. He was already doing, like, checking all the box, takes his health extremely serious. But the only thing he introduced was light therapy. And so, like, anecdotally, granted, that's an N of 1. But that's not uncommon from a lot of the sort of the individual reviews or feedback that we get with guys that are using light therapy for the purposes of testosterone production. A lot of them are seeing the same type of results. And I think the mechanism of action is probably very hormonal, but also, like, with respect to testosterone, you are stimulating, your Leydig cells in your testes to function better as well. So even though the mechanism of action could be, there could be sort of some different mechanisms going on there, but the results seem to be pretty clear.
Yeah, testosterone in men is something we have conversations about every day at my office, and there's so many issues with the typical treatments, even from functional medicine, right? Like, you replace testosterone for a while, it works, and you get those testosterone levels up. But then if you're using creams or injections or pellets or whatever you're using, then you downregulate the production of your own testosterone. So usually over time, it stops working. Now, you also get testicular hypertrophy, so shrinking. And then if anybody is thinking about having a family, you run the risk of infertility. So using testosterone as a replacement just has a ton of reasons why you shouldn't, right? And then HCG is another thing that you can use, but that has to be injected twice a week. So if people are traveling, it just becomes a nightmare, right? And it's pretty expensive. And I've had patients do it and love it. They feel great, but they've got bruises all over their stomach where they're injecting it. And it's just, they feel like a drug addict because they're having to, like, do this all the time. So that's a reason, that's another thing that, yeah, it works for a while, but it's just really cumbersome and expensive. And then the other thing is this Clomid deal that some people get into, and that can be really helpful, but again, it's off-label, so it's expensive, and there's just a bunch of issues that you run into whenever you're trying to treat low testosterone in men. And having an option like this that is safe, effective, relatively low cost, it's really just the time that you spend naked in front of the Joovv light that you have to spend. And so I'm so grateful for this addition to what I can offer men who are struggling, because it can be very debilitating. Mood changes, certainly, like, changes in musculature, libido, erections, like, really can be very life-changing and debilitating for men who are struggling with this. So thank you for what you're doing to help. The other thing that I wanted to chat more about was another thing that we focus on a lot in my clinic, which is neurodegeneration and in cognitive function. So we see a lot of Alzheimer's patients, certainly a lot of mood patients, autism, the whole spectrum of mental health disorders. And Joovv has some interesting benefits in that realm. Can you speak to that? Scott, would you go ahead? I know that you have, I think Dr. Hamlin has had some experience with this.
Yeah, sure. So actually, Dr. Hamlin, who we've mentioned several times now on this podcast, but he's worthy of the attention, considering he's published, I think, over 400 different pieces on PubMed. But that's his actually favorite way to use light therapy, is actually just using one of our smaller devices that delivers just near infrared light directly on his forehead for brain health. And the certainly just like most of the stuff that we've covered here, it's all supported by published clinical research that these wavelengths of light do in fact lead to not only better cognitive function, but actually they help to restore certain issues like Alzheimer's. And there's really even some compelling evidence for CTE, actually eliminating some of the downside ramifications of CTE or concussions, right?
Yeah, this is like what comes up in the NFL is the brain trauma that can lead to cognitive decline and also like violence and things like that. So you're saying that there's a benefit with red light therapy in that context.
Yeah. There's an ample amount of published research already. I'm sure there's probably gonna be more to come. And with our new devices that are Class 2 cleared by FDA, we hope to participate potentially in some of these. But yeah, there's a growing body of evidence that suggests light therapy does not only help with mental clarity and cognitive function, but also helping to restore brain health from some of those chronic conditions like CTE and Alzheimer's and dementia.
What about with stroke? So would a post-stroke patient potentially benefit after an ischemic event?
Yeah, in fact, that's some of the smaller studies actually the participants were stroke victims or stroke subjects. Yeah, so there definitely can be some benefits for that as well.
Great. Well, how amazing, because, with the Neurohacker Collective and myself, our goal here is to make sure that people have that ability to engage with their communities, engage with their families, and contribute at work for as long as possible. And so being able to give people back that function when they've kind of been at that really scary place of like, I don't know if my brain is working, being able to give that back is just so beneficial and really can change not only a life, but like the world and how they interact with their communities. So that is one of the most exciting things about what Joovv has to offer. Do you guys have anything else to add about the benefits of Joovv before you tell everybody how they can get theirs?
Yeah, basically I would just say that don't underestimate the power of light and the incredible role it plays in overall health. It's definitely worth spending a little bit of time to do your due diligence. You don't have to take our word for it. You can do, as Scott's called out, some of your own homework, so to speak, on PubMed. Or as on our Joovv.com on the Learn page. There's numerous articles, every one of which cites numerous studies that you can refer back to as well.
And we'll just be clear, it's not only Dr. Hamlin who's publishing literature on this, right? Like he has done a lot. There are a few others out there, right?
Yeah. There's no doubt, on the topic of muscle recovery and athletic performance, the Brazilians actually do a ton of research when it comes to that arena. So yeah, there's definitely a much broader subset of researchers that are doing work in this arena. But I couldn't echo Justin's comment enough. I mean, and just, speaking from my standpoint too, and really I would just encourage everyone to think about like just their daily lives, their daily practice, from the time you get up to going to work, to coming home in the evening, how much time you're actually spending in natural sunlight, and are you getting the right type of light that our bodies are used to from an evolution standpoint. And if you really sit there and analyze it, that stat that Justin threw out earlier is probably pretty close. Most of us spend about 90% of our lives indoors, and at scale over the course of a lifetime, that's a really, really long time to spend under artificial light, not getting the right types of light that our bodies really need to function properly. And so I would just encourage everyone to kind of stop and think about that in a little bit more detail and just be more intentional about, just like you would if you're into health, just like you would about the macronutrients you consume, be a little bit more intentional about the light that you expose yourself to, whether it's unhealthy artificial light, whether it's certain types of wavelengths during certain parts of days. And in our case, could you possibly supplement sort of your diet, so to speak, or your routine with a healthy version of lights? And so I would kind of piggyback off Justin's comment and just don't underappreciate the power of the light can play in terms of a healthy lifestyle.
So if Joovv is what someone's decided on after doing all of their research, what are their options? I know you have some larger versions, some smaller versions. What are the options and where do they find them?
Yeah, you can find us at Joovv.com, and we have just released our new series of Joovv, the new Joovv modular system. And so what's really exciting about that is now you have even more options in terms of the available treatment sizes. So everything from the Joovv Mini that is great for spot treating specific areas of your body to the Joovv Solo, which is going to treat roughly the upper half of one side of your body. And then we have options going up to our elite setup that's going to do a full 6 foot tall professional athlete, their whole body. So check out the different options there, and we're obviously happy to answer any questions. As we have from day one, we offer a 60-day free trial period. So if you try it out for 60 days and you're not happy, you can send it back for a full refund.
So, Justin, Scott, where can we find a Joovv light? Where can we grab one? I think there's a link through Neurohacker and some cool gifts.
Yeah. So you can go to joovv.com. That's J, 2 O's, 2 V's. So kind of like rejuvenate, but short for that. So joovv.com. I would encourage you to check out a couple different parts of the site. One would be the Learn page, which houses a lot of our educational content. But if you don't want to go too deep, check out the reviews page. It'll house a bunch of different, I think it's close to 400 different reviews. But if you're interested in actually buying the device, go to joovv.com/neurohacker. And we'll be giving a kind of a special bonus out to anyone who purchases a device through that page. So joovv.com/neurohacker. And you can check out our devices right there and get a free gift in the process.
Fun. Thank you both. Thank you both for taking the time to expand my knowledge around the Joovv light and how I think I'll be able to apply it clinically in practice, and just educating all of us about wavelengths and how this works on every cell in the body. I'm so grateful to you both. And we'll have to have you back. I'd love to get comments from any of our listeners about what they thought was interesting, any questions that came up as we were discussing the Joovv light, and how we can best help everyone and all keep learning and growing and being healthier together. So thank you again for spending your afternoon with me, and we'll look forward to seeing you guys again soon.
Thanks so much for having us.
Awesome. Thanks, Heather. Appreciate it.
Take care. Bye, you guys.
Thank you for listening to Collective Insights. For the full show notes on this episode and for more great interviews, visit us at neurohacker.com/collectiveinsights. If you liked this episode, please subscribe to the podcast and leave us a 5-star review on iTunes. Want to learn a better strategy for mental well-being? We designed a beautifully illustrated 32-page guide integrating care for your mind, brain, body, and environment into a balanced approach for a better life. Download the foundational guide to neurohacking at neurohacker.com/guide.